Okay, good afternoon. Thank you very much for participating in our COVID-19 education series.
My pleasure.
We've always believed that education is the key to everything. Dr. Kiffel, thank you so much. Dr. Yakov Kiffel, um, several hats, prominent pediatrician in Monsey. I had the great zchus of having his three sons in our yeshiva Darchinayim, and a good personal friend. Thank you, Doctor. I know you're very busy. I
My
can't.
pleasure.
2 days before Yantif, that's your office is hopping on a quiet day. So thank you very much.
It's important. It's important to be here. So that's the.
Thank you. I've always believed, education. I've always believed education is the key to everything. And so I guess I would love to hear, as a community member and as someone who's trying to get the word out, how do things look from your practice in terms, are the cases going up? What do families need to do? What are the signs that they should look for? What has changed in the past 6 months? What's been the same all along? What's prevention? Go, Doctor.
Right. Okay. So we definitely are seeing an uptick in the number of cases that we're seeing. And I think what's happened is, initially back in March when we had so many cases going on, first of all, a lot of kids were not getting tested because there was a shortage of tests. And Baruch Hashem, thank God that kids generally do well. So it wasn't really necessary at that point to do testing on them. Schools were closed, everything was closed. They really were not going, there was really no public anything at that point. Definitely with any infection, you do get some immunity. Some infections cause lifetime immunity, some cause temporary immunity or relative immunity. So we had a very quiet period over the summer where we were not seeing pretty much any cases, maybe just a handful here or there, but really next to nothing. And at the end of the summer and the last couple of months, we were definitely seeing some smaller outbreaks in different situations, whether in sleepaway camps, some other situations. But in the last couple of weeks, we're definitely seeing a significant increase in the number of cases in the general community. Some with known exposures and many without any known exposures. So it's definitely what we're calling, a community outbreak.
No symptoms?
No, not necessarily no symptoms. So we're not, generally testing people who, who are asymptomatic is not necessary. First of all, we don't really know if they're contagious at that point or not. So it doesn't mean in certain situations they shouldn't be tested, but for example, people working in nursing homes, things like that, where you want to make sure that they're not exposing anyone. But to routinely test people who are asymptomatic, you can get some false positives. It's not a lot, but theoretically that's a possibility, or it could be something that they had 2 months ago and they're showing positive at this point. So generally, routinely testing.
I just wanted to understand, when you said about the exposure, you meant?
Right. So for example, if you have someone in a class that turns symptomatic in a classroom, and so generally the schools have been cohorting the kids into one class or one grade, depending on the school. So for example, if a child on a Wednesday becomes positive, has a runny nose, cough, they come in and they get tested and they're positive, they're potentially contagious for up to 48 hours beforehand. So that's an exposure. So everyone in that class, everyone in that cohort, depending on how the school sets it up, now has to quarantine. So I would not recommend routinely testing everyone in that cohort to see if they're positive or not. If they do develop symptoms, they definitely should be tested because they've been exposed, so they have a new case. But a lot of these cases that we were seeing did not have a known exposure, like a classmate or a relative who had a positive COVID test, and just seemed to have picked it up in the general community, without having a known exposure.
Got it. How are you finding the availability of tests and the efficacy of the tests? I know, again, back in March and April, it was hit and miss in a lot of these things. What is it like now?
So it depends. I mean, generally, I'm using just the major laboratories, LabCorp, and generally I'm getting the tests back in 24 to 48 hours. Rapid tests have a few issues. First of all, it's difficult for a small practice to obtain the equipment to do the tests. They don't have a lot of, there's a shortage of the machines and definitely a shortage of the cassettes, the reagents, the different chemicals, anything needed to run the test. So right now they're preferably giving it to emergency rooms, urgent cares, nursing homes, hospitals, and things like that. Depending on the rapid tests, some are more accurate than others. So depending on the location, depending on the test, sometimes they're even doing a PCR which is an overnight test, at the same time as doing a rapid, get the initial results of the rapid, and then the overnight afterwards. But in my office, I'm only doing the regular lab test, the PCRs, which, as far as we know, are the most accurate at this point.
And you said 24
but there's no
48
shortage of
hours.
the at this point. There's no shortage of tests. In most cases, every once in a while it takes a day longer, but in most cases, I'm getting back in 24 to 48 hours. And after the test is done, if we are suspecting COVID, we ask people to quarantine until we get the results back. Hopefully it's negative, in which case they can go back out into the public. But until once the test is done, once you have a suspected case of COVID-19, we ask people to quarantine until we do get those results.
Are you getting families or just couples coming in to get tested now because they'd like to go to parents for Yontif, to relatives for Yontif? I know this is something that in our own family, we kicked around a little bit.
Right. So, again, someone who's asymptomatic without a known exposure, the question is how necessary it is. If someone is going to somewhere, like they're going to be grandparents or someone who's high risk, I definitely do understand that. The misconception that's out there is that if someone has an exposure, for example, like we talked about another child in the class, that people try to what we call test out of quarantine. So in other words, child was exposed that child was positive on Wednesday, so your child was exposed as of Monday. So I don't know, the next Sunday, let's get a test, and if it's negative, we can go do whatever we want and get out of quarantine. But the problem is it doesn't work that way. You can actually test positive, but you can actually come down with COVID anytime over the next 14 days. So you can test negative on day 7 and on day 10 and still come down with it a few days later. So that's why the 14-day quarantine is so important. And even if you test beforehand, you can't test out of it. The latest statistics that I've seen said that about 10% of cases of COVID that will come out of a known exposure will happen between day 10 and 14.
Wow. I'm
I'm
not sure that everybody
try to test out earlier, you have a significant number.
That's why we're doing this, doctor. So back to my family. We decided, Udi and I made a tough decision that we're staying home and we're not going to visit the kids at Chalamayid. This is a tough one. We were hoping, as of a month ago, it seemed like things were safer than they are, and we just got spooked by the number of cases. But let me just make sure that I'm understanding what you're saying. So that means that let's say, for argument's sake, a child of ours, we have a family, let's say, married kids and a child, and they take a test, not knowing whether or not they're exposed. And then we take a test, and then we come over.
Right.
Theoretically, one of those kids could have gotten it. It could have been exposed in school or playing with friends, had a negative test, and then we come over on day 10, right? And then they haven't been quarantining. So we come over on day 10. So theoretically, day 11, 12, 13, they could be active carriers then, right? They could come down with it. Is that correct?
Correct. And that's the importance of testing people who are symptomatic. I would say probably in my practice, about 3/4 of the tests that I do come back negative, which is great. The fall, people get colds, you can get there are plenty of other viruses that are going around.
Right.
But the importance of knowing if it's COVID or not is, first of all, for that patient and that family to know that they need to quarantine, they need to make sure they're not exposing anybody else. But also anyone who already had an exposure, or they're not spreading it because again, you're contagious for others before, which is what makes it difficult to control if we don't follow these exposures and know who they were potentially exposed to.
Now, carrying that, extrapolating, just finishing up on my. I'm sorry, doctor. Can you hear me? You were coming in and out, doctor. You still there? You back, doc? Can I hear you?
Hi, sorry. I lost you. I can hear you now.
That's par for if CNN does the same thing, it's okay. Yankee and Yankee can do it also. So back to the nitty gritty that all the families are there. I mean, obviously, I don't expect you to, should you or I tell families what to do. But the reality, bottom line, I'm 61 years old. Baruch Hashem, I'm pretty decent shape. I walk 5 miles a day still, but theoretically, there really is no safe way for me to go. I mean, this is mama lashon, as we say, bottom line. If I,
Theoretically,
being that Udi
theoretically.
and I are committed to staying safe, and because, you know, just the age factor, or just generally speaking, there really is no way for us to go to our children and grandchildren's home, no matter what they've been doing, unless they were literally quarantined for 14 days and tested. Is that correct?
Well, the quarantining for 14 days, if they're asymptomatic, there's no need for them to be tested.
Okay.
But if they've been quarantined for 14 days, I wouldn't be worried. But again, the question is, that's difficult to do. Obviously, the kids are in school, people go to school if they have no symptoms, you know, obviously being careful whatever way you can. But, you know, and obviously there's always the balance of, you know, what we're calling now mental health issues and things like that, you know, you know, and there's, you know, everything has a pro and con. But yes, to be truly safe without being exposed at all would be only if people were quarantining for 14 days beforehand, would be the only way to be sure.
Right. I'm saying, so that to us, that's just the rational decision to make, because as difficult as it is for us, you know, it is what it is. You know, at Pesach time, we really didn't have this much information, you know, everybody, but we were all in lockdown basically.
That's for sure.
But
Right.
This additional information is helpful because, you know, like I said, it was something that when did you find this spike in cases? Because, you know, I just had on the coordinator of Hatzalah, and it seems that it really is the last couple of weeks, like,
Yeah.
or is that?
That's what I've been seeing. That's what I've been seeing. You know, again, we've tested people. We know that it's out there. We've been testing people over the last, I would say, since the end of the summer, since we knew there were some issues in some of the sleepaway camps and things like that. And the vast majority were really coming out negative. We did have some cases here and there, but they were pretty rare, you know, for us to see them. The last few weeks, again, we've been seeing about, I'll be honest, I've been doing a lot more testing because we have been seeing that it's going around, and we're about 25% have been positive. And, you know, the main concern, I know people are saying that, oh, well, it's a different strain. We're not seeing the same effects. We're not seeing the same issues that we did, you know, Pesach time. But if we think about it, the exposures Pesach time, you know, the severity of the illness and the deaths, the number that we were seeing Pesach time, the outbreak really started around Purim time. And, you know, you don't really see with COVID in generally the first week, you don't get the severity of the symptoms. That really happens a week, 10 days, even 2 weeks after the initial infection. In some cases it's earlier, but in many cases you don't see it until later on. So even though we're not seeing the severity right now that we saw back then, you know, the question is, could we potentially be seeing that over the next couple of weeks? And
in those same
I've been hearing,
people, or you mean in the community?
no, I'm saying in general. In general, you know, people are saying, oh, it's a different strain. I don't hear of anyone being hospitalized. I don't hear of anybody dying. You know, then we were afraid to check our phones in the morning to see, you know, what had happened overnight. You know, but potential for that is still there.
Josh, the Hatzalah coordinator that I had on yesterday, Josh Hands, he told me that it mirrored pretty much, you know, what you're saying about the last couple of weeks, really things kicking into gear in a very negative way. And anecdotally, I got to tell you, Udi and I, we hear the West Maple, you know, we're 1 block away from West Maple. Right. That horrible week, I think Hatzalah had, like, they normally have whatever, 10, 20 calls over, 30 calls over Shabbos. I think it was 183 that week, that terrible Shabbos, you know, that week when it was so intense. There was nonstop sirens, and we've been noticing much more sirens over Yom Kippur and over the Shabbos. So Josh told me that there was, that he was just chatting with someone in the hospital and saying that thankfully, you know, that they're getting more patients in, but like you said, it's not that severe. And he said that was 12 hours later, there were already they transported 3 serious cases to the hospital. Just in the last, it was just 2 days ago, I think he said.
And I think one of the issues right now, right, and that's what we're seeing not only in Monsey, but I've been hearing from other doctors in different communities. It's a very similar picture where they're starting to see more hospitalizations, starting to see people that are getting more in the level of illness that we saw, you know, back in March. I think one thing that's changed since then is, you know, obviously back in March, the hospitals were completely overwhelmed. We really didn't know a lot about treatment, and obviously that's still developing over time. So a lot of people were staying home on home oxygen, things like that. So and trying to avoid going into the hospital, which at that point was very understandable, and I think probably did help a lot of patients. The difference right now is that there are treatment protocols. Some of them are set protocols that hospitals have. Some of them are investigational. They're in studies. The importance right now is getting to the hospital earlier. So as soon as any difficulty breathing develops, as soon as people start needing supplemental oxygen, that's now the time to go to the hospital, rather what was going on in March of waiting longer and longer. Some people are actually getting.
They were afraid of catching it in the hospital?
No, because they're not talking about people who had it then, but people were staying home because the only option at that point was intubation. There were a lot of trials, people just trying different things, but there was no standard of treatment, there's no standard of care. And they felt rather than being home where they have the support of the family, they have, physicians were going to people's houses, Hatzalah was helping out a lot. And at that point, that was probably the right thing to do. That's changed because first of all, there are many more treatment options that have been shown to be effective. But the problem is you have to get them at the right time. And there are some patients that are only waiting until they're really in severe distress before going in and missing the window of opportunity for some of those things to work. So that has changed a lot since March.
Information to get out to the public.
Yeah,
that
exactly. And that's one of the things that's worrying us, is that people are wanting to stay home and found what they were doing 6 months ago. A lot of things changed in 6 months.
That is really, really important. I'm going to do my very, very best to get it out. Josh did not didn't specifically touch on that. So this is really important information. So let me, because we were chopping in and out. I just want to make sure that I understood what you're saying, that in round one, in other words, 6 months ago, people were extremely reluctant to go to hospitals because the hospitals were overwhelmed. And like you said, they went 0 to 60 on you there and they intubated right away. And now,
right.
Lehefach, people were staying home saying, I'm only going to go there if it's really, really bad. And now you're saying, get in as soon as you can so that the treatments can start before things get bad. Is that correct? Did I understand?
Right. So obviously people should be in touch with, correct. So people should obviously be in touch with their physicians, and every case is different depending on what people's medical issues are and things like that. But generally, if there is any respiratory distress, if you're having any difficulty breathing, that should be checked out right away. We should not wait longer like we were doing in the past, but that should be checked out right away.
And what's the message about masks and social distancing?
So yes, listen, no one knows for sure.
Dr. Kiffel, I've had this chus of knowing you for a very long time. You're a very edel person, very soft-spoken and very refined. Speak Mama Lashon. What do people need to know?
So no one knows in all certainty that what works, what doesn't work. To our best now, to the best of our best information we have right now, masks do help. Are they perfect? No, they're not perfect, but they definitely do help. The biggest problem is that it really only works if everyone wears a mask. If I decide, I'll be honest, I go to shul, I'm wearing a mask. I do anywhere outside. If I'm not in a room alone or in my house, I'm wearing a mask. When I'm indoors anywhere. It only really works if everyone wears a mask, because myself wearing a regular mask will not really protect me well from catching it from somebody else, but it can prevent me from spreading it out, spreading it to someone else. So, the problem is people say, well, I'm not at risk, I don't need to wear a mask. Let the people who are at risk wear a mask. It doesn't help. It can help minimally, but it really doesn't have a major effect on the potential infectious spread of this virus. So really everyone needs to wear a mask to prevent it from spreading. And again, like we talked about before, people are contagious 48 hours before they actually come down with the symptoms. So you can be walking around, going to shul, going to stores, going to your family, and spreading the infection without knowing about it. But if you're wearing a mask, you're definitely preventing at least some of that spread and slowing it down. But again, you need to do it all the time, because otherwise you never know when you might become infectious. So this really only helps if everyone wears a mask.
I'll tell you the truth. Yeah, Dr. Kiffel, the only minyan that I went to was Yom Kippur. Since Rosh Hashanah and Yom Kippur, I had a tent in Rabbi Gottlieb's shul, the old Rabbi Wein's old shul. There was an outdoor tent and everybody was wearing masks. I don't go to shul. I have to take care of my, I have to be precautious. I have to protect my wife. We have to protect each other. I just feel it's absolutely pikuach nefesh for everyone to wear a mask. these interventions that we weigh, close school, don't close school, close businesses, that have negative influences, and you have to do a risk reward. This is just, you're saving people's lives.
Right. And, I personally, I daven in outside minyanim when I have the opportunity. I'll be honest, my father was nifter from this back in March. So I'm davening the Yamid now, so I try to get the Yamid.
I'm so sorry, I did not know.
It was right in the middle of everything, so no one really knew. He was 95, but he was a healthy 95. But I'm davening the Yamid, so when I'm not davening at an outdoor tent, I'm wearing a mask, obviously indoors, even when I'm davening the Yamid. So I think that's obviously people have different whether it's a feeling or a psak, whatever it is, of they have to daven for minyan. There are options for outdoor minyanim, and if you are indoors, please wear a mask and social distance in order to be able to prevent the spread of the virus.
Thank you so much for your time. I know how busy you are. I really appreciate it. My best to Shoshana and the boys, and
thank you. Regards as well. Yes, thank you.
Have a wonderful Yantif. Thank you for your time. Hashem should
you too.
Give you mazel and bracha. Keep up your great work. Be well.
Amen. You as well. Thank you.
Thank you so much. Be well.
Good Yantif. Thanks. Bye-bye.